Thank you, everyone. For those who have joined today's session, you would have heard me already potentially talking about the Mentimeter. For those colleagues who have joined, please feel free to access the Mentimeter via the QR code or via the website, and the number or the code is further up the chat. So feel free to complete. It's basically to understand what your expectations are for the session today, and that hopefully the session will meet your expectations, if not surpass them. If anything is left behind, I'm more than happy to chase and follow that up with you and support you in any way I can. So I am Estefania, or Steph for short. I'm an international nurse myself, and I'm the Regional Primary Care Nursing Workforce Educator Lead. I work within WTE, so Workforce Training Education Directorate, and I'll be supporting you through this webinar today. Let's see. So, what is primary care? And hopefully this is already addressing some of the things that you mentioned yourself before. So for the purposes of this webinar, we'll be using the terms primary care and general practice interchangeably, as this is where the overwhelmingly part of the nursing workforce sits. But in real fact, general primary care includes 4 dimensions, 4 areas, and that is the one of general practice, community pharmacy, dental, optometry services. But actually, did you know that the main source of primary care or primary health care in the NHS is actually happening in general practice? We tend to think that the vast majority and the biggest activity happens in hospital, but in actual fact, that isn't the reality. It is down to general practice to deliver the largest volume of not only consultations, but actually activity in the community. So people receiving services from their GP practices and other services are the majority of them, or a large volume of them, delivered by nurses. And this could be either in person, by phone, or online, and with a GP or another member of the practice staff, obviously, such as a nurse. So we're going to start talking about primary care and primary care in general and how it's structured, so that you gain a little bit better of an understanding of what general practice nurses do. And then we drill down to those who have specialist skills, such as yourself. So just going to move forward. So comparing community versus primary care, you'd probably have heard colleagues using the terms at the same time, but sometimes meaning different things. So you would know that the first level of care is indeed primary care, primary level of care, which may include some community services. But yes, the reverse may happen when we talk about the wider community nursing. We actually can include the workforce and our services that are included in that wider community service, and they may include the primary care nursing. So when you're talking or discussing with someone around community or primary care, my advice would be to ensure that your conversations are clarified as to what is being included in that conversation, because sometimes some colleagues might be looking into community and solely the community and not primary care, and vice versa. And yes, it's true, sometimes even our colleagues get mixed up. So that's perfectly normal, but I would advise for you to gain that clarity as you move through your conversations with colleagues. So what does that mean in our region, which is exactly what happens in the other regions? So primary care networks and GP practices are really the essence of what's happening in general practice, or where the nurses work in primary care. So you'd have primary care networks, which, for abbreviation, and we do love an abbreviation, you would hear potentially around PCNs. What they are in essence clusters of GP practices. What that allow is the fact that they bring GP practices within a geographical area together to provide services at scale. So say, for example, GP practice A doesn't have the service or doesn't provide the service around ear irrigation, but practice B does. Then the PCN, which agglomerates those two GP practices, might offer that service at scale. You probably have felt that in some way. Some of us as a user would have been sent to a GP practice that actually is providing services in coordination either with a hospital trust or on behalf of another GP practice. And what you might have experienced was actually a PCN. So both practices, GP practices and PCNs, are recruiters and employers. So it very much depends on what kind of role you're going to have. Also, it's worth noting that GP practices are not organizations as such, like the trusts or the hospitals that we tend to hear. They operate as small independent businesses. And although they are regulated by and receive funding from the NHS, they act as a separate entity. That means that they are not mandated to follow the NHS terms and conditions or agenda for change, as their services are according to the GP contract that rules their activity. So, in our region, so we are in the east of England, and this is how it's set up at the moment. We are undergoing a transitional period where we've got 6 systems. They're merging and grouping in different clusters. So we're going to go from 6 down to 3. Having said that, in primary care, we're very much looking still into 6 systems that coordinate that work within their patches, their geographical patches, and they are supported through an entity, if we like, that supports their workforce, education and training. They are the training hubs. More on that to come. So what I've done on that little map is to show you on the left, you've got the numbers, and on the right, you've got the abbreviation of what they represent. So that would be Cambridge and Peterborough. Number 2 would be Norfolk and Waveney. Number 3 would be Suffolk and North East Essex. 4 will be Bedford, Luton and Milton Keynes. Number 5, Herts and West Essex. And number 6, Mid and South Essex. Each one of these areas have a certain number of GP practices and a certain number of PCNs, which are detailed there. They equate to over 800 potential employers that you could search employment to if you wish. More on that to come as well. So you probably be asking, okay, so that's well and good, Steph, but what happens actually in primary care and how is our career structured? Well, I would love to show you this next video. The video is based on the Primary Care and General Practice Nursing Career and Capability Framework. That is a framework that sets out the structure for general practice nursing workforce, giving clarity on roles, career progression, and the skills needed at each level. It has 2 main domains: a career framework with 6 levels, from support worker through to advanced and consultant nurse, and a capabilities framework outlining the knowledge, skills, and behaviours required at each stage. I'll put the link for the document on the chat, and I'll put the link for the video that we are about to see on the chat as well. So if you could please just bear with me, and I'll be moving on to the video. If there is no sound, please let me know. I did show it sound, so hopefully it will be okay.
Primary care and general practice are ever evolving to meet the growing needs of local communities. It's an often challenging and increasingly varied clinical environment. This means primary care, general practice teams and nursing roles have evolved too. Nurses in these settings have a wealth of knowledge, skills, and attributes that play an essential part in delivering the best care for people. And as more care is delivered in the wider primary care setting, there are more opportunities for a wider range of nursing roles in addition to adult nursing. These include mental health, learning disabilities, and children's nursing. So that everyone can understand the variety of roles nurses can have and the skills and capabilities they bring to the multi-professional team, the Career and Core Capabilities Framework helps promote and support all nurses in primary care and general practice. The framework is made up of two components. The first component, the Career Framework, sets out 6 career levels for nursing within primary care and general practice. It gives an insight into the knowledge and characteristics required to work at each level, from support worker level through to consultant level. Nurses can see the ways they can progress in their career. The second component, the Core Capabilities Framework, describes core capabilities for each level of practice necessary for safe and effective care. This provides a supportive structure for nurses to develop and evidence their knowledge, skills, and behaviours. Both components of the framework can help the broader healthcare team too. For commissioners of service, it sets out clear expectations of staff. Employers and managers can use the framework to inform workforce development. It also shows the nurses they employ meet the core capabilities, or allows them to put developmental plans in place by supporting appraisals and continuing professional development. This all ensures patient safety and high-quality service provision. For education and training purposes, providers can use the framework to inform their curricula, and supervisors at all levels can also use its structure for assessment. Finally, for people in local communities, the framework will explain what they can expect from nurses working in primary care. As the opportunities for nurses continue to grow, this framework sets a standard and offers pathways for the development for all nurses. So regardless of level or background, nurses have the support to provide high-quality, personalised, compassionate care and have a rewarding career in primary care. To read the Career and Core Capabilities Framework and find out more about nursing in primary care and general practice, visit the websites below.
So I hope that has been helpful, and as I mentioned, I put the link for the document and the link for the video if you want to look into further detail after the session finished. So this is just a brief summary, because again, like I mentioned before, you might be asking me, so what does a nurse do actually in general practice? I tend to say, well, the clue is very much in the name. It's a bit of everything. It's not really just summed up to 1 or 2 tasks. Definitely isn't. So please don't worry. You will be keeping up with your knowledge skills. It's very much in tapping into in many clinical fields, and these are just one of them that general practice supports. There might be opportunities to develop your skills further and to lead clinics based on your areas of specialist interest. So you just need to know what you love doing and find them, or actually propose and negotiate to be created. And yes, in general practice, that can happen. More on that to come when we talk about employment and trying to find employment. So most importantly, now you would be saying to me, okay, but where do my specialist skills can come in then? Where can I be shining? Before going into it, I'm just going to show you a brief video of a colleague and the wealth of things that she does in that video. It's definitely not similar from 1 minute to another, and it definitely does not reflect the whole range of things that a general practice nurse, regardless of their specialism or field of nursing background, can do. So I'm just going to play the video and hopefully it will stop playing. If not, please do let me know.
Time don't make it no pleasure with Love without heartbreak, perspective, reflection, say. For all my days, now that I've got your love, I won't let it go away. For all my days, for all my days, I pray my love won't go to waste. My resting place. In hearts like these, oh, in love like this, the stars align in the sky is of mine, oh, stay the night. As long as the love is left in your eyes, and for the love in your heart.
So let's dive in, particularly to your field of nursing. So children's nurses working in general practice, they can delve into many clinical areas. So when we think about children's nursing, we often picture hospitals, but actually general practice is a really important and growing space for children's nurses. In a GP setting, you often the first point of contact. You're assessing and managing common childhood illnesses, recognizing red flags early and making decisions about escalation. But it's not just reactive care, it's very preventative. You're delivering immunizations, monitoring growth and development, and supporting healthy lifestyles from the earliest stages. What I think is really powerful is the continuity, really. You build those relationships with children and with their families, supporting long-term conditions like asthma, diabetes, and helping families feel confident to manage these at home. Also, what really sets this role apart is the level of collaboration and influence you have beyond the consultation room. You're supporting parents day to day, giving clear, practical advice on symptoms, feeding, sleep, and development, often being that trusted professional families run to first. At the same time, you're working closely with a wider multidisciplinary team, like the GPs, pediatricians, therapists, and even schools, SCIFNs. We're going to go over that in a little bit to make sure that the care is joined up and truly centered around the child. And safeguarding is a key part of the role. You're identifying risks early, documenting concerns, and contributing to wider multi-agency work to keep children safe. And this is very much a developing space. So I would like to thank a special thanks to Nicole, who is helping very much lead and grow this role. She very much had a really active role in bringing together the key aspects of children's nurses in general practice. So just to acknowledge her work and contribution. The same for mental health nurses. So as a mental health nurse in general practice, you bring your specialist skills directly into a GP setting, working as part of a wider team. The same. You might be the first clinician someone speaks to when they're struggling with their mental health, carrying out assessments, managing risk, and deciding what support they need.
Sorry, Steph, to butt in, but you're sounding like a robot. I don't know where, I thought it was my Wi-Fi, but it's not a great connection at the moment.
Oh, okay. Okay. Thank you.
Perfect
Thank
then.
you. Hold on. It will be okay. Is this better now?
Not really. You're breaking up a little bit.
Okay, okay.
Is it worth rejoining maybe? I don't know what you want to do.
It's like when you turn, actually, because it may be better. Try it. It seems when you turn.
I'll switch off my camera to see if it makes any improvement.
Thank you.
Thank you. Does this help?
It does. That sounds much better.
Thank you. Apologies. I don't know what happened. Thank you. I'll keep the camera off. Is it sharing now?
It is.
Thank you so much. Thank you. And apologies. So, as I was saying, as a mental health nurse in general practice, you can bring that specialist skills, that specialism directly into the GP setting, working as part of the wider team. You might actually be the first clinician that someone speaks to when they're struggling with their mental health, carrying out assessments, managing risk, and deciding what support they need. You will support a wide range of patients, from those with anxiety and depression to people living with more complex or long-term mental conditions. You can deliver brief interventions yourself and help people build confidence to manage their well-being. Importantly, you're not working alone. You're part of a multidisciplinary team helping people stay well in their own communities closer to home. In primary care, your role is not just about delivering the care. You also lead and shape how services work. You might run mental health clinics or help design new ways for patients to access support more quickly, like the same-day triage models. You'll play a key role in linking mental and physical health, making sure care is truly holistic. There are opportunities also to support and upskill your colleagues, helping the whole team feel more confident managing mental health. As you develop, you can influence how services are designed across practices, networks, communities, and neighbourhoods. So this is a role that you're not just part of the system, you're actively helping to shape and improve it. So then you tell me, and you can ask, what can that takes me? You know, if I go on to primary care, where can I end up? Really, the world is your oyster. Starting in primary care, it doesn't limit you. It actually opens a wide range of opportunities. You might begin as a newly qualified nurse, supported through preceptorship and structured development programs. From there, you can build on your specialized skills and become more confident managing complex patients and leading your own clinics. And as you progress, those roles become, and you want to go further in roles like consultant nurse, exist in the tissue of the primary care multidisciplinary team. And there you can influence care and structure and services at system level. So this is definitely a career with real growth, flexibility, and impact. I've got 2 videos I will try and play. If it goes robot-like again, please do let me know, and I'll stop and put the link on the chat. I'll just start with a shorter one to see if it works.
My name is Lee Toogood. I am a practice nurse. What I love about my job is the variety, the people we meet, working with the team that I do, and the difference we can make. I thought about it when I was much younger and didn't do it, did other things and felt unsatisfied, you know, and then thought I'd give it a go and enjoyed it.
I can't remember ever wanting to be anything else other than a nurse. The role just appealed to me. I guess I'm curious about people. Everyone that you're seeing has got their own life story, their own issues that are going on regardless of any health problems, and it's more that life story, I guess, that keeps me hooked on nursing rather than the medical and the anatomy and physiology of it all. It's the psychology of nursing that I really enjoy. In some instances, it's like being a private investigator. Somebody comes to the you want to find out what their health issues are, but there's always a lot of other underlying things, and it's joining the dots. And it's the more you ask questions, the more you dig deep into what's happening for that individual in front of you. Practice nursing, you're in that you might see babies for vaccinations, you might see children for asthma checks, all the way through to, you know, routine screening of healthy adults, cervical screening, blood pressure checks, health promotion, and then managing chronic diseases. And I think my role has grown more in that area in terms of looking after patients that have got respiratory problems, especially COPD, asthma, also diabetes, heart disease. And a lot of these patients now are fairly well, would simply see their practice nurse for all their routine care. I have days and weeks where I come in, I see patients, I change treatment, I follow them up, and I don't discuss anything with a GP. And equally, you become a specialist in your own role. You might get the opportunity to specialise in respiratory or diabetes, and you learn in a lot more depth about disease. And often the GPs will refer to the practice nurses because they're now the specialist in that disease area. I think having been a newly qualified nurse for 7 or 8 years on an acute medical ward that was very busy, initially I was a bit, will it be very slow in practice nurse, as emotionally sort of satisfying? But I think it is more so in a way, because you build proper deep relationships with patients. You're in a team that largely doesn't change in general practice. You're working with GPs, your nurse colleagues, the reception staff, the social seat staff that might come in. And I think you can really grow as a family and mould the care that you give. And I think practice nursing is growing more into, I guess, a more holistic art. I think all of us are a lot more aware that it's joined up. There is no health without the social care backup, family, community. I would say it's all as important as checking somebody's blood pressure. People might come and see a GP or a practice nurse for half an hour every 6 to 12 months. Every other day of the year, they're looking after themselves, they're dealing with that illness themselves. So I think it's all about empowering people to know who to contact, know what to do, and it's trying to navigate the healthcare system, which is quite complicated for a lot of people. And I think general practice, we're the gatekeepers of that in many respects.
So this is just an extract from a colleague that is working in our region. She has been asked what were the top 3 reasons why she chose to work in general practice and primary care, and what would be her top 3 things why she loves working in primary care. And she mentions being the autonomy and ability to grow as an independent clinician, the work-life balance, her career progression, and that she absolutely loves to know her patients and the continuity she's got with them. The responsibilities and extensive skill set. It's definitely not reduced to one clinical area. This is where your specialized skills are very, very much welcomed. And the fact that she's got weekends off, she also mentions that. So, okay, let's start on the other part of the presentation. What are the offers? What is out there for you to maximize your success in finding employment in general practice? There is a module, which is the CNO 002 Discovering a Nursing Career in General Practice. This is a 3-month module that provides an opportunity to gain better understanding and awareness of primary care and general practice. And it helps nurses and nursing associates, for those who would like to apply, to submit a positive application to general practice and help to prepare for an interview. It will cover skills and knowledge such as learning how the role fits within the multidisciplinary team, developing one-to-one communication skills, and understanding how to operate in a primary care environment. What I'll do is that I'll add the link to the web page from NHS onto the chat, as well as the link for Teesside University on the chat. And I'm highlighting Teesside University because they do deliver at national level. That means that although they are from another geographical area different from ours in the east of England, they're from the north of the country, the way in which they deliver doesn't require you to travel. And because we don't have a local HEI within the east of England that delivers this module, Teesside has been the one that has been supporting very closely and working very closely with us in supporting colleagues undertaking and enrolling in this module. The link is on the chat, both for NHSE and for the module for you to find out. So I'm just picking up on something that I mentioned to you about training hubs. So training hubs are, in essence, an education team, very much like the education teams you liaise with in trusts and hospitals, but they operate in general practice. So they support the workforce and support students, they support placements, they work in articulation with GP practices and PCNs, in articulation also with the education providers, whether that will be universities, colleges, etc., schools, etc. So they aim to provide that support to meet all the education needs of the multidisciplinary team. They support nurses as well as receptionists, doctors, etc. And if you'd recall previously in the east of England, we have 6 systems and there is a training hub per system. So I will be putting later on their email address for you to contact your relevant training hub if you'd like to know a little bit more about what they're doing. They've got multiple programs and initiatives to support you in your early career. And this, please, is definitely not an exhausting list. They do implement new initiatives depending also on population needs and their workforce needs and their landscape, obviously. So, but they have initiatives such as the preceptorship, the new to practice, stay and thrive, professional nurse advocate, legacy nursing mentoring, leadership opportunities, primary care networks, and neighbourhoods, which is going to be the next sort of input from general practice, working at neighbourhood level with multiple stakeholders across the system, including community trusts and local authorities and hospitals working together in neighbourhoods. So here is the general email address for you to be able to contact your relevant training hub. Feel free to reach out to them. And apologies, the font, I can see the font is quite large. I don't know why it was doing that, so apologies for that, but that is the email address that you can reach out to them. What I'll do is to just delete the one from Norfolk and Waveney as they have merged with SNE. So whilst I'm doing that, just apologies because I realized I've not deleted that one. Okay, so you've got them there. Now, top tips before we hand over to any questions. Top tips for a nursing CV in primary care. You've had some really excellent tips from the first webinar. I had the pleasure to attend that webinar, so I'm not going to go through it. But what I would say is that the key point is, similarly to what was mentioned before, to tailor to that specific job in that specific practice or PCN. A PCN or a practice are inserted in a community that may be different from the other PCN or practice that you've applied for. You've got PCNs or practices that are very rural, whereas others are very urban. Some PCNs and practices are in areas of deprivation, whereas others are in areas of wealth. So they have different needs depending on the needs of the population they serve. What I would suggest is to include that summary, a professional summary focusing on clinical placement experience. And if you haven't had one, please don't panic. You'd have experience as a user of a GP practice. You would have potentially experience as an informal carer. So any experience that you can relate and any of your transferable skills, even if you hadn't had a placement, please include them. They're really valuable because then they understand that you understand what primary care and general practice or PCN mean. Use the key terms from NHS values and person specification. Highlight that you've got or are waiting for a registration PIN. Focus on your skills from placement. Now, I've highlighted in neon yellow the kinds of application that are very different from the traditional hospital adverts. Yes, you can apply and should apply if you'd like to for a job that is being advertised. But one thing that is very different, and that I would strongly encourage, is for you to submit spontaneous applications. Even if the GP practice that you'd like to work is not advertising currently for any nursing post, you might wish to ask to either meet up with the practice manager or with the GPN lead and ask if there are any vacancies coming along, or actually, even more so, demonstrating your knowledge about the population that it serves, knowing that, for example, there's a high incidence of asthma in children, or there's a high incidence of depression, and children reporting bullying from school, or that you know because you are a parent or you know of someone or you're relative to that person, and that is something that you've got really good skills and you like to support the team and actually support the population, whether that will be by setting up a clinic yourself or to be part of the team. Please don't let the lack of an advert stop you or deter you from applying to a GP practice or a PCN. Like I mentioned, the world is your oyster. Now, one thing I would like to say is be alert to potentially negotiate your salary. Yes, that's true. Because remember, when I mentioned at the beginning, they aren't organizations. They are not following Agenda for Change, the majority. Having said that, some do, but others don't. So please feel free to boost up your negotiating skills and be prepared to ask what will be your salary and what does that look like in the future if you were to choose to stay with them. That is all from me. So what I would say is thank you so much for your time. And what I would ask is for you to complete the feedback form. You've got the QR code there, and I'll post the link on the chat. It only takes an average of just under 4 minutes, and it will be really, really, really valuable, because then I can tailor future sessions if there's anything you feel that might be missing. But I wouldn't want to take away precious time for opening up for questions. And hopefully now the internet will behave a little bit better. I'm not sounding like a robot. And I'll stop sharing in a little bit. So I'll try actually come on camera again, and let's see if I'm still talking okay, or is it like a robot? Or if any questions, please fire away. I'm eager to hear from you. Sounding okay, thank you, thank you. Any questions? I would love to hear from you. I know we've got a blend of year twos, year threes. So if you're in year two, my advice, and if you're interested in going to primary care, my advice would be get in contact with your training hub, demonstrate that interest, and ask if you could have placements there. Speak with your university and ask if you can have placements in primary care and GP practices, and they will help you in guiding you as well. They have really good connections with the HEIs, and they will help you through the process and guide you. any questions, please? Were there any questions on the chat, Sue, please? Because I wasn't looking.
There wasn't.
No.
There wasn't any questions.
Okie dokes. Thank you. I hope I didn't put people off by sounding like a robot. We're not robots. So feel free to reach out. Each one of the training hub will have a colleague. You're very welcome, Hannah and Julia. Not a problem. I would please encourage, and apologies if I hope I'm pronouncing it correct, Teresai. Please do reach out to your training hubs. They will be your really good port of call and help you in understanding what is general practice. How can they be alert for the fact that you might be coming along? The other thing along to general practice. The other thing I would strongly encourage you is to look at the CNO 002 module. It's a free of charge module. And you can do it at undergraduate level for those who are undertaking the nursing degree. If you're still in year 2, if you're in year 3, you can also undertake an undergrad level. If you want to, you can undertake it after you qualify, and then you can take it either at level 6 or level 7 to build towards your master's. The link to the university gives you a brief overview of what the module looks like. And if you need further information, you can scroll down and it has the indicative content, but it's very much, like I mentioned before, around giving an overview of what a general practice nurse can do. And then you most definitely bring your specialized skills to develop and not only share but develop those specialized clinics and supporting the population that you will be serving. That's definitely a plus, a skill. Any other questions? No? Okay. Let me know. I'll just stop sharing for now. Please do complete the webinar form. Is really important. If that's okay, please. I'll not put the link again on the chat just in case. I'm going to stop recording. Oh, so do you want to come in? Sorry.
Just to say to all the students on the call this afternoon, if you haven't downloaded the Student Healthcare app, there's a QR code that I've just put in the chat, and there's going to be a wealth of resources that you can find to support you transitioning into a newly qualified post. There's also a whole range of webinars covering different professional areas where you could work, and also to make sure that you're future ready around creating your CV, preparing for interview, questions that may be asked, good tips, etc. So please use it, as it's a one-stop shop that will be posting any available jobs or resources that you may find useful.